I'm Marie Langham, and I'm a retired professor from South Dakota State University. I was a professor of plant pathology. I came in 1991, and I worked with the department for 30 years. Really appreciate Dr. Knudsen because he is such a considerate and caring physician, and he is direct with you, and he's easy to talk to, and he understands your concerns. And I was so nervous the first time. For the first one, I was just so nervous. Dr. Knudsen came in, and once he was in and he was there kind of behind me, he started talking to me. And he's telling me exactly what he's going to do. And his voice is calm, and he's explaining it. And he was so comforted. And it just came to me that I'm going, he knows exactly what he's doing. Like, I didn't have any doubts of that, but there was just this very comforting feeling of how he knew exactly what was happening. At that moment, I just relaxed. All of the staff were very kind and caring, and they were all concerned with what your needs were, and I found that very, very good. I mean, I've had some medical procedures done at places where you were kind of just, they put you in and just left you alone, and they didn't really talk to you too much or something. But they were checking on you, making sure you were okay, making sure your comfort was good, that you were warm enough, and all of those things. And when you're coming out in the recovery, they were there to check on you and to make sure. And I felt like the standard of care was very high. In between the surgeries, when one eye is done and one eye is not, it's like you're seeing it's like watching high-def TV. And the other is this just gray, yellow, murky, cloudy. And you're going, I found myself all the time just sitting there going like this, compare one eye back and forth all the time. And it was so amazing. I'm going, how could I have been looking through all this stuff? And everything was so yellow. And you look over here, you've got all these blues that you weren't seeing at all because it was so yellow and murky. And so it was just wild. Just watching the differences between the two, that it was just amazing. I was one of those people who I've been all my life terribly nearsighted. Although as had gotten older, I had developed presbyopia, where you become farsighted. Well, the lens they put in give me far sight, and so I just need my glasses for my up-close vision. And that has been such a wonderful experience. Well, for the first time in my life, I have no restrictions on my driver's license. I was one of those people who had always been very nearsighted, and I'd always had restrictions. And I went in to do it, and I was a little scared about doing the eye test. I read the whole thing through without one stop. It's something that just makes me happy. I'm happy because I can do that. And I've been very happy that I got this procedure done. It has made my life much more secure. One of the things about living by yourself that you worry about is you worry about, are you going to trip and fall? Are you going to do this? Am I going to be able to use, because you need to use your car to take care of yourself. And I feel so much more secure about things like that. I feel more secure in my driving, my able to get back and forth. I feel much more secure in my house and to be able to take care of myself. And also it's given me the ability to enjoy my life more. I enjoy the care and concern they show for you. I enjoy the dignity that they treat you with. I've been through specialist's office and things who you feel like you're just an object on the checklist for the day. And that you never feel that way. I would say that you should go ahead with it. Don't be afraid of it. And I was beforehand, I was really afraid. And I did fine.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.